name is Emma Netchig, and I was in a group with Margaret and Johanna, and today I will be teaching you a little bit more about anaphylaxis. So what is anaphylaxis? Anaphylaxis, or anaphylactic shock is another way that it is described, is a life-threatening allergic reaction caused by a foreign substance introduced to the body. It can occur within seconds or minutes of exposure, and it's characterized by a sudden drop in blood pressure and narrowing of the airway. And 20,000 to 50,000 people have anaphylaxis per year within the United States. So some common symptoms of anaphylaxis, they're pretty well known, but skin reactions such as hives, itchiness, redness, flushed or pale skin, low blood pressure, which is the main characteristic of anaphylaxis, constriction of your airway, which makes it really hard to breathe, swollen tongue or throat, and that causes wheezing, which also makes it really difficult to breathe, a weak or rapid pulse, nausea, vomiting, diarrhea, and then dizziness or fainting. So some common causes of anaphylaxis would be food. So maybe you've eaten something that your body is not a fan of, could be fish, eggs, peanuts, milk, products, chocolate. There's a lot of different allergens within those foods. And it's the most common cause of anaphylaxis. Medication is another really common cause of anaphylaxis. So penicillin, antibiotics, aspirin, over-the-counter medications, and penicillin is the #1 medication cause of anaphylaxis. So people are most likely to have an allergic reaction to penicillin, and it's 5 patients per 10,000 courses of medication given. Insect bites such as bees, wasps, hornets, yellow jackets, fire ants, those can all cause it as well. And then aerobic exercise, sometimes people, it's very rare, but sometimes people can develop anaphylaxis just from running or even things such super mild such as walking. So treatment. So they'll do a few assessments, and they'll take a history, a physical exam, psychosocial. They'll ask you about any recent food intake, medication ingestion, outdoor activities, and exposure to exposure to insects. They'll also look at your symptoms and make sure that they began within 5 to 30 minutes of exposure. And then in the earlier signs and symptoms begin, the more severe the reactions. They'll just tell them what they're kind of going up against. And then for the physical exam, they'll look for hives, flushing, any skin abnormalities. They will palpate the body, listen to the lungs, assess the breathing, take other blood tests, and then for the psychosocial exam, they'll also make sure the patient is doing okay, that they're not feeling impending doom or expressing feelings of helplessness. And for the diagnosis, there's really no specific lab test needed. It's really characterized by the symptoms. So treatment. So if they stop breathing, you have to do CPR because of the swelling in the airway and sometimes that sudden change in blood pressure that can happen. And then you also can give medication. So a lot of people will carry an EpiPen with them, which is just a dose of epinephrine, which jolts their body back and reminds it that it needs to keep functioning, and it gives it that extra power source. You can also give them oxygen if they're having a really hard time breathing, intravenous antihistamines, or cortisone, which will reduce the inflammation of the air passages and improve their breathing. And then also a beta agonist such as albuterol, which is also an asthma medication to just relieve those breathing symptoms as well. So prevention of anaphylaxis, you want to avoid substances that cause an allergic reaction, which is sometimes easier said than done. But always you can wear a medical alert necklace or bracelet just in case you did have an allergic reaction and people would know that that's what it was. You can store an emergency medical kit with you at all times. It has your EpiPen, some other things that you might need. Always tell your doctor if you have medication reactions so that they make sure to not prescribe that if you ever have a hospital stay or need prescription medications. And then a few other things are to try to avoid stinging bugs that you know you're allergic to. If you have food allergies, pay close attention to food labels, just so you can avoid any allergens within food. And then be prepared with your EpiPen or other treatments at all times. So prognosis and follow-up. In many cases, delayed treatment will result in death. However, if you have treatment right away, there's a very good outcome and almost everybody can fully recover. So patients are monitored for at least 4 hours after their last dose of epinephrine, just to make sure that their body is responding okay, and that they're staying healthy and safe. Always carry that self-injection pen, the EpiPen again. And then you'll probably get referred to an allergist if you haven't already, just so you can kind of nail down what your allergy is, and then they can help you with a plan from there. And then also learn more about anaphylaxis and be prepared for another attack so that you can prevent them in the future. So these are my sources. I got my information from the Mayo Clinic. If you guys have any questions, feel free to ask.